Hello, my name is Tara Anspach, and I'm speaking on behalf of the Lynn Clinic of Children's Hospital of Pittsburgh in conjunction with UCP class. This webinar will focus on the topics of traumatic brain injury, or TBI, and augmentative and alternative communication, or AAC. Both of these topics are near and dear to the hearts of speech-language pathologists, but these topics overflow into the lives of many professionals working with individuals with disabilities. Traumatic brain injury affects 1.7 million Americans. In the disabilities field, we are almost guaranteed to work with an individual who has suffered from some sort of TBI, whether it be major or minor. Knowing the specifics of brain anatomy or neurophysiology are not needed to help these individuals. What is most important is incorporating them back into their usual routines, communities, and family lives. Environmental modifications, compensations, and supports may be just what these individuals need from us. And then there is augmentative and alternative communication, or AAC. Imagine having a lot to say and needing another way to produce those words without your voice or mouth. This is where AAC comes in. The range and depth of AAC devices available would take days to cover, but a few important principles can go a long way in helping an individual who uses AAC. Your brain is the powerhouse and control center for everything you do. Brain injuries can be sustained in many different ways. Common functional impairments that are expected after someone sustains a TBI occur in the domains of motor, such as paresis on the side of the body, sensory, such as discomfort due to bright lights or loud noise, communication, such as the loss of language, cognition, such as difficulty sustaining attention, and behavior or personality, such as poor safety awareness or disinhibition. After personally working on an inpatient TBI unit over the summer as an SLP graduate student intern, I can personally say that no two people are affected in the same way by an injury to their brain. A multidisciplinary team is essential in helping these people to integrate back into their community. Commonly, communication, cognition, and behavior can be compensated for by recognizing and assessing what is most important to these individuals and where they need the most support. Communication deficits that may be common with individuals who sustain a TBI include word-finding difficulties or loss of language, difficulty using language in social contexts as expected, problems with motor programming for speech or speech articulation difficulties due to damage or weakness in their speech musculature, disorganized or unclear language, which may be evident when they're telling a story, problems with turn-taking and maintaining a topic in conversation, and decreased intelligibility, which may make them difficult to understand. A few ways to help individuals with their communication include, first and most importantly, considering the impacts of the deficits that these individuals are experiencing. It is essential that we are helping them with skills and functioning that are important to them and that they rely on in their day-to-day lives. We can help them by simulating situations or using role play of day-to-day situations that the person might encounter, such as ordering food at a restaurant or meeting a new person. This helps them to prepare the language needed in that situation to overcome unexpectedness and problems with disinhibition. Another way to help is to create scripts. A script is just like the one used in theater as a pre-planned document laying out step-by-step for the person what to say or do in a conversation or situation, such as a phone call to order a prescription, which can be pretty routine, so giving the person a layout of what to expect ahead of time could be helpful. Another way to help is to train with communication partners. The easiest way to help is to give the person opportunities to practice everything they are working on with you. It's better for them to make mistakes or say something inappropriate or get stuck on finding a word with someone they are familiar and comfortable with first. You can also help with topic cards by practicing with the person, staying on topic, and going back about a specific topic or event if this is something that is important with them. Other ways to help include environmental modifications such as timers, daily calendars, and personal planners. The things that may be expected for a person who sustained a TBI considering their cognition or thinking. They may need extended time to complete tasks that were once autonomous or routine. They may have difficulty remembering in the short or long term, and they may also forget things that occurred before their TBI. They may have difficulties paying attention, difficulties with solving problems, decreased ability to plan or keep organized, and decreased resourcefulness or problems drawing from the knowledge, people, skills, and abilities that they once possessed. So think about how a decrease in any of these domains would affect your everyday functioning. They are pervasive into every aspect of life, including family, home, work, and activities of daily living. So some ways that we can help people who sustained a TBI with their cognition boils down to supports, environmental modifications, and compensations. We can help by helping them to create memory books, which may be helpful to help them remember events or people from the past, and these also help to strike up conversation and reach common ground with the individual. We can also help them to get transitional or supported employment, which may be very important. Imagine going back to work and all of the daily tasks, conversations, phone calls, and duties that it entails. Without support or transition in place, a return to work may be impossible. Also, structure and predictability is very important. We should not make unannounced visits or appointments. We must plan ahead with the person and make the details concrete by writing them down so that they are aware of what is to occur. Also, we should decrease environmental distractions, which can decrease attention and behavioral problems. We could close the blinds, ask for only one person to speak at a time, and keep the lights dim. We can also use compensatory strategies that are helpful, such as a timer or alarm, graphic organizer, daily schedule, cell phone, or checklist to help them complete activities. Therapy is not always key for these patients, but rather we should help them to compensate for their deficits and modify their environment to allow them to best participate and reintegrate into the community. We must think about what is important to them and what do they most want to return to or participate in again. The second topic that I'm going to cover is Augmentative and Alternative Communication, or AAC. AAC, or the International Society for AAC's mission, is to promote the best possible communication for people with complex communication needs by helping them to, first, say exactly what they want to say, and secondly, say it as fast as they can. The AAC annual convention actually came to Pittsburgh last August, and there was a wide range of AAC users there from all over the world. Many people rely on AAC to communicate. So most importantly for individuals with AAC is that they have a way to communicate. It is impossible to know everything about every AAC device because there are so many on the market and they all have very different features. The full range of AAC covers manual communication boards, which are simply a piece of paper or a board with symbols or words or letters on it in which the person points to for communication. There's also single word switches, which is another type of AAC where the person pushes a button and a single word is produced. The full AAC range covers all the way up to voice output communication aids, which allows the user to select manually through direct selection or through scanning or eye gaze what they want to say on the screen, and the machine verbally produces the utterance aloud. As you can see, there are so many AAC devices and options out there. It's impossible also to know how to program or troubleshoot technical problems on an individual's AAC device due to the wide ranges of devices out there. But what is important for you to know is that the individual should have enough training, practice, and exposure to their device that they become efficient and comfortable with using it. If an individual is a new AAC user, we should encourage them to use the device to interact with us to gain exposure to their device. It is also important that individuals who are using AAC devices that are high-tech and electronically operated have a backup way to communicate in case something would happen to their system. Think of being by a pool or in water, or what if the battery would die? We need to make sure to establish either a gestural communication system with the person or encourage their speech-language pathologist to devise them a backup manual communication board in case something would happen to their device. No one should be left without a way to communicate. It's also dangerous. Finally, an AAC device or board should include core vocabulary, which are words that make up 85% of what people say, even though they are small words, such as I, have, on, it, is, and no. These words might seem pointless and sometimes are disregarded, but contrary to popular belief, putting a person's hobbies, favorite foods, and family members' names on their devices' boards will not be that helpful because they do not spend the majority of their time using these words. If you don't believe me, strike up a conversation with your significant other or roommate and record 2 minutes of your conversation. You will use core vocabulary much more often than hiking, sleeping, Johnny. Speak to the person using AAC and their SLP if you do not know this core vocabulary on their device. This slide includes examples of manual communication boards that may be implemented to facilitate language as the main resource for an individual. Sometimes children use these, or in hospital settings they may be helpful. They are also helpful as a backup if a main AAC device becomes broken or unable to be used in a certain situation or setting. As you can see, the boards are color-coded, which makes them easier to navigate based on the parts of speech or commonalities to the individual. They are also a great backup system, and they are easy to create. You do not need to be an SLP to create one of these for an individual. The computer makes it very easy. Finally, they're helpful in healthcare settings if the patient is unable to communicate due to intubation or another healthcare situation. That concludes the end of this webinar. If you have any questions, feel free to contact me at the email address listed. Thank you.